Ah, meat, the most dopamine-releasing way to get protein into the human body, flesh. Hi. Have you ever taken a big bite of heated flesh only to find a blob of skin, shards of bone, or a rubbery chunk of cartilage?
This is how the food industry increases the amount of meat we consume in our diets. But little do we know, it is one of the main reasons negatively affecting the kidneys of millions of people. If you're experiencing frequent trips to the restroom, difficulty starting or stopping the flow of urine, or discomfort in the pelvic area, there's a chance you may be dealing with an enlarged prostate. These symptoms not only make daily life inconvenient but can also negatively impact your overall quality of life. But here's the good news, your diet can make a big difference in supporting prostate health. The foods we consume daily can either help reduce prostate size or, on the contrary, worsen the condition. Today, I'm here to walk you through 9 foods to avoid if you want to shrink your prostate naturally and effectively. Some of these may surprise you, and even the most harmful food on the list is a familiar item often found in many people's daily meals. So, if you're serious about taking care of your prostate, pay attention to this list and make some notes. Don't overlook these important dietary pitfalls that many men face every day. Let's go back to the first one. 1. Red meat. Red meat contains a high level of saturated fats, which is linked to an increase in inflammation in the body. A study published in Medical Daily shows that people who eat a lot of red meat have about a 40% higher risk of developing kidney disease compared to those who eat less meat. Additionally, too much red meat can exacerbate symptoms such as difficulty urinating and having to wake up several times at night. The inflammation caused by consuming excessive red meat can lead to several complications, including impaired kidney function. To minimize these harmful effects, it is essential to consider some alternatives. Replace red meat with lighter protein sources such as fish, chicken, or even vegetables. These substitutes are not only friendlier to your prostate but also provide essential nutrients without causing inflammatory responses. 2. Processed foods. Frozen meals, French fries, and fast food may seem convenient and tasty, but their negative effects on prostate health are quite concerning. First, it's important to understand that these foods often contain unhealthy fats, preservatives, and excess sugar. The close link between processed foods and prostate health lies in the harmful ingredients they contain. For example, high sodium levels and artificial additives can lead to water retention and increased blood pressure. This puts pressure on the kidneys, the organs responsible for filtering waste and excess fluids from the body. Moreover, these foods lack essential nutrients needed to maintain proper prostate function, leading to a higher risk of infections and chronic diseases. It's crucial to note that chronic inflammation caused by eating these foods can worsen other health issues, including those related to the prostate. To minimize the risks associated with processed foods, opt for fresh and natural foods. Incorporate fruits, vegetables, and whole grains into your diet, as these foods are not only nutritious but also support the body's natural healing process and help reduce inflammation. For instance, leafy greens and berries are excellent choices that can enhance your kidney and prostate health. 3. Dairy products. People often think that dairy products are essential for a healthy diet. However, I want to talk to you about the potential negative impacts of these products. Dairy products contain hormones and saturated fats that can be harmful to your health. Recent studies have shown that consuming too many dairy products can increase the risk of prostate diseases. It is important to note that these products can cause inflammation in the body. The hormones found in milk can elevate inflammation levels, complicating the management of prostate health and thus affecting prostate function. If you are older, it is crucial to pay attention to these connections. Additionally, chronic inflammation can lead to serious health problems. For those with benign prostatic hyperplasia, considering a reduction in dairy products in your diet may be a positive step. Choosing plant-based alternatives like almond milk or oat milk can not only help reduce prostate symptoms but also provide additional benefits for overall health. These alternatives tend to have lower saturated fat and do not contain the hormones found in milk. 4. Fried foods. These foods are often cooked in unhealthy oils that contain high levels of trans fats. These fats are known to promote inflammation in the body. A study published in the journal European Urology found that consuming high amounts of trans fats is associated with a significant increase in prostate issues. Researchers discovered that men who consume more than 3.5 grams of trans fats per day are at over 50% higher risk of experiencing serious prostate-related symptoms compared to those who consume less than 1.5 grams. Furthermore, it is important to note that fried foods not only affect the prostate but also contribute to weight gain, especially in the abdominal area. This excess weight is linked to a higher risk of developing prostate problems. Abdominal fat is a well-known risk factor for various health conditions, including prostate issues. Instead of frying, let's choose healthier cooking methods such as baking, boiling, or steaming. These methods are not only more prostate-friendly but also help maintain a balanced diet and reduce inflammation in the body. Finally, it is essential to pay attention to the quality of the oils we use in cooking. Choosing healthy oils, such as extra virgin olive oil, can make a significant difference to our overall health. 5. Caffeine. A cup of coffee every morning is essential for many people. Many individuals, especially those who are used to relying on caffeine to get through long days, may not realize the negative effects the substance can have on our prostate. First, consuming too much caffeine can lead to dehydration because the kidneys have to work harder to eliminate excess fluid. A study from Harakopio University in Greece, conducted in 2017, showed that high caffeine consumption may be linked to an increased risk of developing chronic kidney disease. In this study, it was found that individuals who consumed more than 3 cups of coffee per day had a 50% higher risk of kidney problems compared to those who drank less than 1 cup each day. For people with high blood pressure or kidney disease, caffeine can worsen your symptoms. Stimulating the bladder and prostate with caffeine can lead to an increased need to urinate, especially at night, which disrupts sleep. This can create a vicious cycle, as lack of sleep can contribute to health issues. It is important to mention that many of us are unaware that not only coffee, but also tea, sodas, and energy drinks contain caffeine. Therefore, if you regularly consume these beverages, you may be irritating your bladder and prostate without realizing it. To minimize these effects, consider reducing your caffeine intake or even choosing the decaffeinated version of your favorite drinks. By doing so, you will likely notice a decrease in the frequency of urination and less irritation in your urinary tract. 6. Gluten. Many people may not realize that gluten can negatively impact prostate health. For those who are sensitive or intolerant to gluten, products containing gluten such as bread, pasta, and processed foods can cause inflammation in the body. Gluten has the potential to stimulate the immune system, which can enhance the inflammatory response in the body. In the case of the prostate, this increased inflammation can hinder the normal function of this gland, worsening the symptoms of benign prostatic hyperplasia, BPH. Therefore, it is important to pay attention to our diet and the types of foods we consume. For those experiencing symptoms related to the prostate, eliminating gluten from the diet can lead to significant improvements. I recommend considering the incorporation of gluten-free grains such as quinoa, brown rice, and other whole grains. A gluten-free diet is sometimes recommended for those experiencing symptoms related to prostatitis, which is often confused with or related to BPH. These alternatives are not only better for the prostate but also provide essential nutrients to maintain overall health. 7. Spicy food. Spicy food can make our meals more appealing and delicious, but the risks it may pose can be concerning. Capsaicin, the active compound that gives chili peppers and sauces their heat, can irritate not only our taste buds but also the urinary tract. A study conducted by Peking University in 2017 revealed that consuming too much spicy food can increase inflammation and irritate the bladder. In this study, it was observed that over 32% of men over 50 who regularly ate spicy food experienced symptoms such as urgency and frequent nighttime urination. Additionally, continuous irritation of the bladder can lead to infections in this area. Instead of spicy foods, you might consider choosing milder seasonings such as fresh herbs, garlic, or turmeric. Adjusting the amount of chili used in each meal also plays a significant role in protecting your kidneys. 8. Alcohol. Alcohol, often seen as a way to relax or socialize, can become a silent enemy for men with benign prostatic hyperplasia, BPH. The relationship between alcohol consumption and prostate health is significant. Drinking alcohol increases urine production, putting extra pressure on the bladder and prostate. This added pressure not only makes you need to urinate more frequently, especially at night, but sleepless nights can become a painful routine, severely impacting your quality of life. Furthermore, alcohol can irritate the prostate, worsening the condition over time. If that isn't enough, men who drink excessively also face the risk of additional health problems, including cardiovascular diseases and metabolic disorders. For those looking to reduce the size of their prostate or manage its symptoms, cutting back on alcohol consumption or eliminating it altogether can lead to significant relief. 9. Carbonated beverages. It is a well-known fact that carbonated beverages, especially soft drinks, are among the main foods we should avoid. These drinks contain high levels of refined sugars, caffeine, and acids that can cause significant side effects for our bodies. This study shows that men who consume more than 1.5 liters of soft drinks each week have a 30% higher risk of encountering prostate-related issues. This is an alarming statistic that makes us reflect on our eating habits. Carbonated beverages not only increase blood sugar levels but also contribute to obesity, a serious risk factor for prostate health. Obesity is linked to increased inflammation in the body, which can exacerbate prostate problems. Additionally, the caffeine in these drinks can irritate the bladder and prostate. To minimize these risks, my recommendation is to replace carbonated beverages with healthier alternatives. Plain water, herbal tea, and natural unsweetened fruit juices are excellent choices that not only help keep our bodies hydrated but also improve prostate health. Making this change can reduce symptoms and support prostate recovery. And those are the things you need to avoid to shrink an enlarged prostate. We hope this information will be helpful for you in improving your prostate health. Before we conclude, I would like to ask you, are you concerned about issues related to an enlarged prostate and its effects on your health? Please leave a 1 in the comments section below the video if you are interested. If you found this video helpful, don't forget to like and share it with your friends and family. This not only helps them receive important information but also contributes to creating a healthier and happier community. I hope you will continue to join me in future videos. Wishing you health and happiness, and see you in the next video.